My name is Brian Massa, and I'm the Director for Global Health Advocacy here at the United Nations Foundation, and I manage government relations for the Shot at Life campaign. We're here during the throes of Advocate to Vaccinate, and I know you guys have been working hard, contacting your members of Congress, writing them letters, scheduling meetings, writing op-eds, all to defend and advocate for our child immunization programs that Shot at Life supports. So thank you in advance for all of your work. We still have about 2 weeks left of A2V. So I wanted to take a couple of minutes to update you on a few things that have developed over the past few weeks. If you went to joined our Shot at Life Summit at the early March period, you will have heard some of this information, but there's also some new things that I think everyone will be interested to hear. So right now is a really great time to check in on these funding requests. As you know, the pandemic has set back child immunization over a decade in just 1 year, leaving approximately 3.7 million more children or under vaccinated than in 2019. And of those 23 million, 17 million are considered zero-dose children who have not received a single dose of vaccine like measles vaccine or any other life-saving routine vaccine. So now is an incredibly important time for you to be talking to your members of Congress about the critical need for investment in these programs. I'll get into our guests in a second, but I wanted to provide some context for why we're making these requests. The reason for this decade of loss is twofold. First, it's partly due to the pandemic interruption of services. Many of the investments in health workers, global health workers, the immunization service, delivery people in communities, the disease detection assets that the US government and multilateral programs had invested in for years, those services were all pivoted for COVID response 2 years ago. It was a necessary pivot too, and one that I think the global community appreciated. In part, these services were pivoted to respond to COVID-19, and it showed the effectiveness of how these services could be utilized across horizontal platforms. However, 2 years has passed, and it's time to get back to core funding for these services. The same services that were supported by polio, measles investments, Gavi, WHO, UNICEF, and that brings me to our fiscal year 23 requests. So take a look at your talking points documents or the full fiscal year 23 appropriations doc that the Shot at Life campaign has provided for you. You'll notice that we are asking for level funding for Gavi, the Vaccine Alliance, this year. However, you will also notice that we're asking for large increases for a number of different immunization accounts that Shot at Life supports. And that includes an increase for UNICEF, and that includes an increase for CDC measles work. But right now, I want to quickly focus on polio, because those are two of the largest increases that we're asking for this year. As I mentioned, during the pandemic, the polio assets were pivoted towards COVID response. The amazing investments that CDC and USAID have developed in the country were important pandemic response tools. However, we are also in a critical moment for the polio eradication initiative. Last year, there were only 5 cases of wild polio in the last 2 endemic countries of Pakistan and Afghanistan. It's a 96% reduction from the previous year, and the lowest number of wild polio cases for the past 2 decades. So we're at a critical moment for polio eradication. The increased money for USAID and CDC will help us get over the finish line, as well as tackle outbreaks of vaccine-derived polio in a number of countries in Africa. So take a look at your fiscal year appropriations document. I've unpacked the funding requests for USAID and CDC for polio, as well as our other priorities for Shot at Life campaign. Talk to your offices about this. Drill down deeply into the need for this. If you haven't already, contact your House office and ask them to sign on to the polio eradication Dear Colleague letter, which is an internal letter in Congress that simply asks other member offices to support polio eradication. There's contact information in your talking points documents, and as well as in the appropriations fact sheet. The Senate polio appropriations letter has not yet been introduced. It should be introduced in the coming weeks, probably toward the end of Advocate to Vaccinate at the end of April. We will, of course, let everyone know when this letter goes live so that you can start contacting your Senate offices to ask them to sign on to this letter as well. In addition, as you may know, World Immunization Week is the last week of April. What we put together for this is a landing page for congressional offices to visit with a menu of tweet and social media options that they can post on their channels to support and mark this important week. By April 20th, I'm going to be sending an email up to all House and Senate members asking them to visit this landing page and post a tweet for World Immunization Week starting on April 25th. So if you're having meetings or scheduling phone calls with your offices between the 20th and the 29th, feel free to reference this email and ask your members of Congress to post on social media for World Immunization Week. So that's my update for now. If you have any questions, you can always email us at champions@shotatlife.org. If you are talking to your House member offices or eventually your Senate member offices, and they provide you with an appropriations document to fill out, feel free to just hit forward, send that to the champions at shotatlife.org email address, and we will take care of that for you. So thanks again. Take care and onwards with our advocacy.